Welcome to Body Mass Index Assessment and Supporting Well Visits. We're excited that you're here today. Before I move on to the learning objectives today, you can hear us, but we cannot hear you. As you have questions, please feel free to put them in the chat, and we have a portion at the end of the session for questions and answers. If you wish to have closed captioning turned on, there should be a button on your screen that either says CC or closed captioning. We also have a set of evaluation questions at the end of the webinar that we encourage you to complete, as it helps us to provide the best content and tailor it to the voices of those in the field. We would love to hear who's here today, so feel free to put your name, your location, and your role. We would love to know so that we can tailor it to you. Today's learning objectives are to define body mass index and explain its role in assessing child growth and health, describe the importance of BMI tracking during well visits for early identification of health needs, and apply best practices for discussing BMI with families in a supportive manner. My name is Mandy LeBlanc. I get to be a contractor with the School-Based Health Alliance. I have over 20 years of experience in health, education, and school-based health, and I am from Seattle, Washington. I'll pass it over to Gone after I let you know that Donnie has been pulled away for a live presentation today. Go ahead, Gone. Thank you.
Thanks, Mandy. Good afternoon, everyone. My name is Gone Job. I'm a senior manager with the School-Based Health Alliance. I am a registered nurse by training, as well as a project management professional. I have over 13 years of experience in healthcare, and 9 of those have been a nurse. And I've spent most of my career working in pediatrics, supporting children and families. And I always like to say that I've worked in almost every place that you can find kids, from hospitals to clinics to homes and even schools. Prior to coming to SBHA, I worked at an FQHC where I was a registered nurse focusing on pediatrics. So I did a lot of care coordination, clinical training, implementation and QI workflows, as well as launching a school-based health program that offered mobile and telehealth services. So today I'm really excited to be putting on that clinical trainer hat as we talk about BMI and well child visits. So before we get started, I want to hear a little bit from the people who are here in the chat. If you can just let us know, is BMI a standard part of your clinic's workflow and a standard part of your well child visits? So a simple yes or no if BMI is a standard part of your workflow. Okay, yes, great. All right, and I get to see some yeses. Wonderful. Okay, moving forward. So when you hear BMI, what comes to mind? Since we're an intimate group today, I want to interact in the chat a little bit. So when you hear BMI, body mass index, what comes to mind? Is it a number? What comes to mind when you hear that word? All right. So a little bit of a history of BMI. BMI began in 1823, and it has been used for nearly 2 centuries, but its role in pediatrics is still evolving. It expanded to include children in the late 20th century, and by 2010, BMI growth charts and adjusted norms were in place for youth. BMI is a public health indicator. It connects to obesity, diabetes, and overall chronic disease prevention. So let's get into the why. All right, so what is BMI? BMI is a screening tool to assess weight status. It is a number calculated using the weight and height, and in children, it's typically interpreted as a age-specific and sex-specific percentile. So whether they're male or female, compared to those of their own age. So for example, if you're in the 70th percentile for BMI, that means that you are compared to 70% of other uh, boys or girls of the same age. That's where you're at. So that number just kind of tells us how you are compared to those that are like you. We do want to note that BMI is not a standalone diagnosis, and we should also consider muscle mass, population, fat distribution, and lifestyle. And if you're new to BMI, you may be familiar with the growth chart that is pictured on the slide, which includes the visuals of those percentiles and trends. So there are 5 categories for BMI percentiles in children and teens. Prior to 2022, BMI growth charts capped at the 95th to 97th percentile. And in December of 2022, the CDC extended the growth chart references for children and adolescents between the ages of 2 and 20 with very high BMIs. So this allows us to be able to capture and visualize the growth trends of those with higher BMIs that are above the 95th percentile. So as you can see, those percentiles are 5th percentile. So if you're below the 5th percentile, you're considered underweight. If you're between the 5th and 85th percentile, that is typically considered a healthy weight or a normal weight. 85th to 95th percentile is considered overweight, and above 95th percentile is obesity. And then with that extended growth chart, the 100, if you're at or greater than 120, 20% of the 95th percentile, you're in that new classification of severe obesity. So just some images of those extended growth charts. There's ones for boys and ones for girls, and it allows us to recognize those patterns early so that we can start to have those important conversations about nutrition, exercise, and overall health. So now let's discuss why this matters so much, not just physically, but also emotionally. So childhood obesity is a common and serious chronic disease that has been on an increased prevalence for the past 4 years. Obesity increases the risk for serious health conditions even during childhood, such as high blood pressure, prediabetes, type 2 diabetes, and breathing problems. So this sets up patterns of illnesses that can last a lifetime if not addressed early. The effects of obesity aren't just physical. Children with obesity are more likely to struggle with anxiety, depression, low self-esteem, social isolation, peer dynamics, bullying, and body image concerns can profoundly affect mental health and school performance. And with school-based health centers, we are at the intersect of health and education. So we want to make sure that we're addressing all parts of that whole child so that they can show up as their best selves. Today, about 1 in 5 children and adolescents has obesity. Prevalence rates are even higher among lower income families, which many FQHCs and school-based health centers serve. The highest are with middle schoolers and high schoolers, followed by elementary school children. Severe obesity affects about 1 in 16 youth, a growing concern that requires early and sensitive intervention. So where do we have a structured opportunity to address these these risks early? That's at the well-child visit. So well-child visits, also known as well care visits, wellness exams, physicals, preventative care visits, whatever your organization calls them. They are the cornerstone of pediatric care. So similar to how school-based health centers offer the most comprehensive health services, Well Child Visits offer and deliver comprehensive evidence-based preventative care. They can also allow providers to identify health risks early and be able to intervene early. It's recommended to do these visits annually by the American Academy of Pediatrics for those that are over the age of 3. During these visits, we're not just getting vaccines, we're addressing growth, development, mental health, and more. BMI screenings and anticipatory guidance are essential. They allow us to be able to spot red flags and address any concerns early on. So why does BMI matter in well child visits? Being able to utilize BMI helps us with early detection. So it helps us spot risks like unhealthy weight gain or undernutrition before they become a real issue. It allows us to track growth. So it shows us a trend over time to ensure that the kids we're caring for are growing steadily and proportionately. It's a great conversation starter. So being able to offer a neutral way to talk about nutrition, activity, and healthy habits, as well as being able to provide that timely support, prompting for early intervention if they are in those higher categories of their BMI, and being able to do things like counseling or referrals to prevent chronic conditions. So if your sponsoring organization is a federally qualified health center or an FQHC, annual well child visits, BMIs, and nutrition counseling are a part of your UDS metrics, so your data points that you report as a part of your funding. Patients with a high or increasing BMI should be counseled on nutrition and exercise activity to encourage healthy weight. This can look like talking to the child or family about, making healthy choices or offering educational material to meet this need. Effective counseling is respectful, non-judgmental, and actionable. So focusing on small achievable goals, centering the conversation around health and not weight, offering resources, referrals, and community programs. Even non-clinical staff can reinforce these messages, whether it's through cafeteria options, activity programs, or just trusted conversations. BMI measurements should typically start at around age 2 or 3, depending on your organization and recommendations, and then repeated annually. We track the trends. We don't just look at those isolated numbers, and a gradual climb in those trends across the percentiles over time, if it becomes concerning, is what we want to act on. And as always, remember that BMI is one data point. It doesn't tell us the full story about what's going on with that child. So we must consider the full picture: growth patterns, family history, lifestyle, and social influencers of health. So I'm going to pass it over to Mandy so she can talk to us more about some strategies and interventions to be able to have these conversations within the well child visit or outside of the well child visit.
Thank you, Gone. I get to talk about how to support children and families. So we want to focus on health instead of weight. We want to use neutral language, so let's talk about healthy growth. I'll dive into motivational interviewing a bit more in this presentation, and I just want to hit pause to say that one of our goals in this presentation is to reduce and remove the awkwardness of having a conversation after measuring BMI and talking to students and families about their weight as it relates to their height. And so one way of doing that is to focus on health and positive changes that someone can make, focusing on using intentionally neutral language such as healthy growth and motivational interviewing. Then being clear about providing practical, direct, and appropriate recommendations. One tip that can work is to ask somebody for their why. Why do you want to have the best possible health you can on your life's journey? When we put ourselves in someone else's shoes, we can get curious about the reasons they may want to do as many things within reason to take good care of themselves. So providing practical, appropriate recommendations can be the way to go, staying neutral and talking about why they want to make these changes. Now, a deep dive into motivational interviewing. This has become a passion of mine. I've seen strong positive impacts from motivational interviewing, which is a client-centered counseling approach that helps individuals explore their feelings about change, their readiness for change, and their motivation to take action in different areas of their lives. It focuses on enhancing motivation and commitment to specific goals rather than directing or advising someone. This approach can be particularly effective when someone is ambivalent and is designed to guide people through a process of change. It allows for a welcoming dynamic for building trust and support, and it makes the person understand that they have control over their outcomes and you are there to be their guide. By asking open-ended questions and summarizing their responses, you allow the other person to be in control of their actions. The 4 stages of motivational interviewing are pre-contemplation, contemplation, preparation, and action. And the 5 A's of motivational interviewing are asking open-ended questions about health behaviors, readiness for change, reasons for wanting to change, advising based on specific circumstances and needs for each individual's and potential benefits for change, assessing, which is understanding risks and benefits associated with someone's current behavior, assisting with sharing resources and support for proposed actions and helping to overcome obstacles. And the 5th is arranging next steps such as follow-up appointments for check-ins. I got to experience a motivational interviewing training early on in my career through Hallways the Health program. The Hallways Health program is something that you can find on the School-Based Health Alliance website. And to learn more, there are a lot of free and low-cost virtual trainings available online that focus on the benefits and how-tos of motivational interviewing. So I'll look back at this slide and discuss that it's all about engaging and making a connection, guiding, not directing, but jointly finding a focus for next steps. Evoking, using internal forces to bring about change, meaning what is that person's why on why they want positive change, and helping them craft a plan, a strategy for change collaboratively. Next up, we'll discuss measuring success and long-term impact. Body mass index improvement initiatives often combine multiple strategies, including lifestyle changes like dietary adjustments and increased physical activity, along with policies and environmental changes that promote healthier choices. Also, encouraging students and families to have an annual well child checkup, also known as physicals, allow you to track somebody's BMI through their key years of growth and development. There are some examples of successful programs, such as the Eat Well, Play Hard, which takes place in New York State. This program implements a multi-component approach to address dietary changes, increase physical activity, and reduce screen time. And then a program that I used in my experience with Hallways to Health was called the 5210 program, started at Penn State. This program encourages individuals to consume 5 or more servings of fruits and vegetables, limit the screen time to 2 hours or less, engage in at least 1 hour of physical activity, avoid sugary drinks, and drink more water. I like to add 7 at the beginning for 7 or more hours of sleep, as that tends to play a role in somebody's overall health. And I'll talk about so those are the real world examples and the role of follow-up visits in sustaining healthy outcomes. So it's not just enough necessarily to meet with somebody once a year and take a look at their health numbers. Having ways of following up either through messaging or quick checkups and follow-ups is a great way to maintain continuity in focusing on what you've just reviewed during the motivational interviewing phase of a well child visit. Now I'd love to hear in the chat some strategies that you use for integrating BMI in your well visits. So we would love to know what you're already doing, such as standardized BMI screenings, which is a part of the workflow in clinical settings and allows you to track year-to-year height and growth. What tools and technology do you use to streamline documentation? And how do you engage families in discussions about BMI? This is your opportunity to add in the chat anything that you do that could help others. Give it one more minute in the chat to see if you have any ideas, and then we'll move on. Okay, we'll leave more time at the end in case you have any other questions and ways. Great. Measuring BMI at every visit, that's wonderful. Great. Standard BMI screening and workflow in clinical settings. And we can revisit this at the end. My background is in communication, and so how to effectively communicate BMI trends to families. Addressing nutrition and physical activity are a way of learning more about how a family operates and what decisions they make. So using effective techniques for healthy eating and active lifestyle, talking about how food is fuel and movement allows us to have improved quality of life sometimes, sharing resources and referrals for families, such as what exists in your community. This takes a little bit of research and adding a calendar reminder for you to, right now you're in the webinar, but sometime looking at what community programs exist. And also age-appropriate guidance for different developmental stages. So reading up on those in advance and knowing the age group that you're working with, you tend to become experts in that age area and having those conversations about ways to infuse nutrition, physical activity, sleep, and stress management into our daily lives to help with these numbers. Some other conversation starters. So I find a lot of people, these visits tend to be quick, but questions that you can ask that allow you to learn more about how that person is feeling that day and what their day-to-day habits are when was the last time you felt well rested? That's an opportunity to listen about a time that hopefully you feel well rested over the weekends. And weekdays can be difficult, but if they say it's been months, that's an opportunity for a deeper conversation about sleep as it relates to overall well-being. Asking how you manage your stress level allows you to gauge how stressed somebody is and allow them to open up a little bit about what they do to maintain their stress, playing a role in the overall well-being as it relates as well to nutrition and physical activity. We know when we're stressed, it can be more difficult to find time for physical activity, and we may make choices for meals that aren't as healthy when we're stressed. And asking what your go-to breakfast is during the week. I find this especially helpful to ask students. It's very common as students get older and in the later years, usually in elementary school, hopefully they're having breakfast before school. And then in middle and high school, breakfast can get a little more complicated as far as what students are eating. And so it's a good opportunity to discuss the importance of breakfast. All right. Love to know in the chat how you handle conversations of BMI with youth, how you're feeling about it. So if you feel comfortable at writing in the chat, wonderful. If not, I just want us all to pause and think about where we are in our level of conversation around BMI. It can be a difficult topic to ask, and hopefully that's why you're joining this webinar and learning more. Our goal is to help you move the needle a little bit on having more comfortable conversations around health as it relates to body mass index and the bigger conversation of obesity, because we want to help everybody become more comfortable on creating positive change in that dialogue. Thank you to all those that have responded. It seems like we're landing around a lot of 3s and 4s, and I see one number 1, and that makes me happy to see. Maybe you can share some examples, Raquel, of what you're using that makes you feel extra comfortable if you feel up for it. All right. Infusing youth perspective at school. So it's very easy for us to come up with the answers and know how to do this well. And then we have an interaction with the student, and it's a constant reminder that youth have a great perspective on what they need. So in health classes and clubs, having a fun competition to create health education materials to help people make healthy choices and help them remember the importance of packing a lunch or having lunch at school. In a way that is helpful and youth focused. So I find when youth can create the materials, it's way more likely to be reviewed by the students. So the more that students can create this in health classes and other things for in their classes or perhaps extra credit when possible. Also, having health students make weekly morning health education related announcements is a wonderful way of having the youth voice be infused. And would love to also hear in the poll in the chat how else you think we can infuse more youth perspective at school. I'd like to do a bit of a deep dive on portion sizes because I was surprised at how much I myself didn't know some of these answers in the beginning, and also how much youth often don't know the portion sizes. So what I love and when people go food shopping is they can see the portion sizes, but most people don't read those or don't know how to read them, and they don't know that one container could be 4 or 5 servings compared to one serving. And so the image on the right there showing that meat is usually a deck of cards. You don't need a huge portion size to get your serving of protein every day. Also, another surprising image is the pasta or rice, that one serving is the size of a yo-yo. So sometimes you'll see students and some adults taking these large portion sizes, and it's okay to have 2 portions per meal. I'm not necessarily saying that that's wrong, but what I am saying is just be aware of the portion sizes and using these examples. And so I've also used the analogy of a fist for a yo-yo, a small fist, and sizing of fruits and vegetables. We want to increase the amount of fruits and vegetables servings and keep an eye on carbs are what give us energy and they're important, but being aware of the portion sizes. And then another one we use is 4 dice can be 1 serving of cheese. And I've also said that a thumb, the size of your thumb, is about 1 portion. So teaching students to use that early on is a great life lesson and a reminder of the sizes of portions. So another thing that people can do at home and when packing food for school is using smaller plates or bowls and reducing overall portion sizes for those that have a high BMI. Infusing nutrient-dense foods as close to nature as possible, such as grains, proteins, fruits, and vegetables. And I know that students don't always love eating foods that are close to as nature as possible, but having that conversation can serve as a reminder that it's finding the balance. And also, this is an opportunity to discuss finding new forms of physical activity, perhaps with a group that you might enjoy, such as movement breaks, finding new ways to keep physical activity creative, and intentionally setting aside time to move your body. This relates back to portion control, that we need that balance of the right amount of energy in our bodies through nutrition to be able to then be active. So it's okay to talk about portion control as it relates to how active we will be later in the day. All right, some key takeaways from today are that BMI is a screening tool and one way of measuring health, not a diagnosis. That we track percentiles over time, not just one measurement. We're looking at that flow that Gone showed of the growth as it relates year to year. So it's okay to have some years. Often humans grow wider than taller, then wider than taller. And so it's looking at the growth chart as a whole. Using BMI to support well child visits and anticipatory guidance. Early intervention can be equate to better long-term outcomes. So it's having that annual dialogue and reminding families and students to return every year and keeping the focus on healthy habits, not just our numbers. And now a call to action, getting more comfortable and having some practice sessions about weight and BMI trends in all youth well visits. So I encourage you to, after we wrap today, find time to practice what you've learned with a colleague or a friend. and engaging youth and families in their care plan. They should absolutely be a huge driver in their own health, and that motivational interviewing allows you to be a guide while they step into the driver's seat of their own health and well-being. And I'd like to take a minute here to just pause. Life can be busy and full sometimes. I just want you to take a moment to weave this all together. We've thrown a lot of information at you. So we'll take a minute or two just so you can think about how you can improve clinical workflows in your approach to BMI, knowing there are opportunities and areas for improvement when navigating patient health, mental health, and well-being. So we'll give it 2 minutes for you just to sit and take some notes for yourself to think about this. Give it 1 more minute so you can think about this answer. Feel free to put it in the chat or think to yourself about what you've learned today and how you could approach things differently, or get ready to start thinking about the questions you want to ask Gone and I. You can put those questions in the chat or you can keep thinking.
And as you're thinking as well, many of you are already doing wonderful work. So feel free to share what you're doing that's working really well for you in applying, talking about BMI, talking about weight and healthy habits within your well child visit. So I saw a few in the chat from earlier that we'll bring up as well.
Here are some resources. We will be sending this slide deck as well as the recording out in about a week. And so you will be able to access these additional resources. Okay, we now have a poll to learn more about what you learned today, see what we're doing well, what we could be doing better. We would love it if you could just take a minute or two to answer these questions. There are 5 questions, and it shouldn't take too long. We'll leave it up for a while you start to post your questions. We'll give it 2 minutes. See if we can get more people to complete the poll while we share our ways to stay connected. So you can scan the QR code, and you can also find these links so you can learn more about upcoming webinars and other interesting activities through School-Based Health Alliance. Great. Okay, thank you. It's now time for question and answer period, and I have a question of you all while we wait for questions to arrive, which is, from the youth perspective, how could you think about infusing what that person's why is and why they would want to improve their health? And a tip on that is that so many times somebody's health is related to, as it relates to youth, tends to be more short term. As adults, we think longer term. But what would make somebody want to improve their health in the short term for a student or their families? So I'll ask that question of you while you answer and think of your questions.
as our audience is countering Mandy, I want to go back and talk just a little bit more about what happens at that fall child visit. So child is coming in with their annual visit, and this might be your opportunity that you're seeing them, once a year or once in 2 years or however long it's been. Um, they get vitals done, they get assessments and screenings done. If they're due for immunization, those are recommended. And a large part of those well child visits is the provider providing anticipatory guidance, which is just making some recommendations and giving some education and counseling around, growth and development. So depending on your age, here are the milestones that you should be hitting. Depending on your growth and development, here's what we recommend for nutrition to look like, for exercise and physical activity to look like. So a lot of the stuff that you talked about with portion sizes, the 75210, all of that can be incorporated into those anticipatory guidance that the provider does. I also understand that these visits are limited and there's a lot happening within a short amount of time. So if the provider does not always have the time to provide anticipatory guidance with the focus of, hey, let's look at your BMI trends, let's give you some additional education. I saw in the chat that some folks utilize their registered nurse to do the follow-up, maybe at a separate appointment or to come in afterwards and be able to provide that education. So finding ways to really sit down with that student, that family, and to be able to talk to them about, the why, as Mandy said, why is it important that we look at your trends, that they're visual, being able to print out your BMI growth charts, your height and weight growth charts, and to be able to explain to them, this is where you're at compared to other boys and girls that are around your age. This is where we would like you to be at. What are things that we can do to work together to do things for the benefit of your health? So really just thinking about what are your approaches that you are currently taking, and if not, what are things that you can do? And I see in the chat someone also shared that their nurse practitioner uses My Plate Picture, so being able to use visuals to have those discussions, and also being able to be aware of, like, if you're working in a school-based health center and it's just the kids there, being able to have those age-appropriate conversations about nutrition and physical activity.
Great. Feel free to put your questions in the chat as well, but I also see that Christine mentions that they use an RN to do follow-up healthy lifestyle appointments. And I want to say that I was in that role where I was, after a nurse would have an appointment, then my role was I often use this 75210 as an introduction. And so we usually do that 3 times before I got used to having a student in my office and having them get used to getting to know me. And I was amazed at how they would open up more over time by asking those questions. And I want to share an example of a time that I learned that somebody needed additional resources because the 3 times they kept saying that they didn't use screen time at all. And I thought that was really impressive because of the high use of screen time in youth. And it turned out that they didn't have access to electricity. They were living in a tent. We were able to find out more information. Other times I used 75210 and I would learn about some mental health support that they would need and to be able to connect them to somebody to get additional mental health support. So the 75210 can be a great opportunity to start a dialogue and have that feel free. It may feel awkward at first, but if you have that conversation 3 times, there's actually a great book about the importance of having 3 cups of tea. And in this world, I say having 3 conversations about 75210 and how that can really open doors is a great opportunity to get to know a student, build trust, and allow them to open up a little bit more with you. And that way you can provide more resources for that student. Are there any other questions that you have from the chat before we get into some questions that we have from our list? Okay. I'll ask a question back to the attendees and those that are watching the recording that if you put yourself in a patient's shoes, a student's shoes, how would you like a professional to discuss how weight can impact health? So we'll give it a minute to think about how you would answer that question. It can put you on your heels at first, but then thinking about how you would like to have the discussion can help you pave the way for stepping in somebody else's shoes when you have to have that conversation. And Gone, I have a question for you now if you're ready for it. How can providers use well child visits more effectively to identify beyond just height and weight checks?
Yeah, that is a great question, Mandy. And I'll answer it with a note that I do understand that there is a little bit of a shift happening with how people are using and looking at using BMI. So understanding that this is a screening tool, understanding that we should be looking at trends, and also understanding that it is not the only indicator of obesity. You should be looking at many other things before you determine that your patient is obese or at risk of becoming obese. One way that providers can utilize BMI if they're not already is with the anticipatory guidance, as we talked about. So um, a lot happens at that well child visit, and that is your one opportunity if you don't see that patient again to be able to give them some guidance around their overall health and well-being. So if you're not going to see them again for another year, maybe 2 years, what all do they need to know? Like, depending on that BMI, if they're at that 85th percentile, 90th percentile, like over that 85th, where you may be a little bit concerned about their weight, being able to have that conversation so that when they come back in a year or more than that, um, you're able to see like how are things going? Did they apply any of the guidance that they were told? If not, let's continue to provide that counseling as a part of early intervention. So it's really a tool um, to be able to help those within the well child visit to be able to provide the early intervention along with all of the other things that are being done.
You answered another question I had, which is that body mass index is just one part of a person's health numbers, and you already covered what some other ways are to determine somebody's health. And I want to focus on that health and mental health are so important, and they're very intertwined. Great. Any other
Yeah.
questions from the chat?
I did see that someone said that they measure BMI at every visit, which is great to see. So it's not just happening annually, it's happening at every visit. So if you're not able to take time and provide that counseling during the well child visit, being able to implement that at every visit where you're taking a weight and a height, that allows you some time to talk about their weight and to provide some early intervention as well.
Great. I say we'll give it one more minute, and then we will also be available to answer questions, so we can stay on if you have a personal, more directed question for yourself and your practice. Thank you.
As we say thank you, I recognize that it is Nurses Week. So happy Nurses Week to my fellow peers in nursing, nurse practitioners, wherever you're at, whether you're an LPN, RN, APN, happy Nurses Week, and you are appreciated for all of the work that you do in the field. Thank you all for joining us. Like Mandy said, if you have any other questions, don't hesitate to reach out to us at SBHA. Until next time, have a wonderful day.